everyone, welcome to another session of Info Pills at Pausepill with me, Dr. Pooja Bhat. When it comes to birth control, there are so many options out there. Choosing the right method depends on several factors. Today, we are going to discuss one such barrier method of contraception, the diaphragm. The diaphragm, it works similar to that of a condom. It acts as a physical barrier, preventing the sperm from meeting the egg. It is a small dome-shaped device that is made of either latex or silicone, and it has to be placed over the cervix such that it blocks the sperm from entering the uterus. They come in different sizes, materials, the type of silicone present in them, and it is not one size that fits all. It is important that the initial fitting is to be done by a healthcare professional. Although there are single-size diaphragms that do not require fitting, it is always better for a professional fit tested. Now, to discuss how to insert diaphragm, initially wash your hands with soap and water. Squeeze the rim of the diaphragm into an arc shape. Apply a teaspoon of spermicide onto the dome of the diaphragm using either your finger or an applicator. Additionally, water-based lubricant can be added to the rim of the diaphragm to aid the insertion. This diaphragm has to be inserted into the vagina such that it snugly fits over the cervix, just like that of an insertion of menstrual cup or a tampon, but make sure that it covers it completely. An ill-fitting diaphragm can get dislodged or it can cause discomfort to the bladder. It can be inserted hours before planning a sexual intercourse, but once inserted, it has to be retained for 6 to 8 hours after last ejaculation, but not beyond 24 hours. If more than 6 hours have passed since insertion, additional spermicide of 5 ml can be placed in the vagina before another act of sexual intercourse. After use, it is essential to cleanse the diaphragm with mild soap and warm water and then store it properly. It's important to note that oil-based lubricant should not be used with latex-based diaphragm as it can break down. Let's talk about the lifespan of diaphragm. Latex-based diaphragm can be used for 1 to 3 years, whereas silicone-based ones can be used up to 10 years. Refitting is required after a vaginal birth, a C-section, any pregnancy loss beyond 14 weeks, major pelvic surgery, or a significant weight loss. Coming to the advantages of using the diaphragm, it is low cost, reusable, hormone-free, not affected by usage of other medications. It can be used on demand, and it is safe to use while breastfeeding the baby. It does not interfere with the menstrual cycle, and it does offer some protection against sexually transmitted diseases. The return of fertility is immediate upon stopping the usage of it. However, there are some disadvantages to the usage of diaphragm. It requires a healthcare professional for initial fitting and refitting. It requires some amount of training to use it correctly, and you need to keep track of hours of insertion, as beyond 24 hours increases the risk of toxic shock syndrome. It is rare but a serious complication of bacterial infection. It does reduce the spontaneity, and some experience urinary tract infections, latex allergies, or irritation to spermicide. Now, let's talk about the efficacy of diaphragm. For those who use it correctly and consistently, it is 94% effective. So that's it. Like any other birth control method, it is important to understand how to use the diaphragm properly and to weigh both the benefits and the potential drawbacks. Thanks for joining me today. This is me, Dr. Pooja Bhat from Pausepill, signing off. Let's take a pause for the good.